managers. What we were looking at was the lack of ability to recruit qualified staff in a rural region, to fill positions around Division 1 nurses and an ageing workforce as well. What we did was link a number of strategies that were already being implemented. We already had conversion from Div 2 to Div 1 as a relationship with Charles Sturt University. And what we decided to do was build that as a career pathway from Certificate 3 and 4 in aged care, Division 2 and then conversion at a local level. So what we have implemented over the last 3 years is a traineeship program where we were training approximately 60 people per year in Certificate 3 and 4 in aged care and lifestyle and leisure, and then putting in a course of Division 2. Now what we've actually got are 18 graduates from Division 2 who are also qualified in aged care, and they will commence their conversion next year into Div 1. We have a cohort of around 32 students who are completing their conversion from Div 2 to Div 1 currently with Charles Sturt University. As part of the strategy, we have now put in a clinical educator support role which supports all the students through that whole program except for the Certificate 3 in aged care. So what has happened for us in a local area, people are able to train from Certificate 3 level right through to Division 1 whilst working within the system. So once they're doing their Certificate 3 traineeships, they work within the HAC and the aged care residential services, and then once they've finished that, they move into Division 2, so they can actually work and study locally, and they're already employed within the hospital setting, and they go externally for placement, so they have a whole range of learning and educational opportunities, as well as being employed. The majority of students say that they would not travel, they have to either travel to Shepparton, Wangaratta or Wodonga to actually complete their nursing training. And for some people that's an hour, for some people it's half an hour. They say they couldn't afford to do that. So what we have actually picked up is a whole group of women, especially women, we've had 1 or 2 men, but it's mostly women, who have always wanted to do nursing or have a career pathway, but because they were local rural women on the farms, they've never had that opportunity. So we've actually captured what I would say is an excellent standard of student, an excellent standard of people who are entering our health workforce who will stay because they are local people. We have been fortunate in that the drought has affected people, so we've had people who are coming off the land for the first time to have a career, and our cohort of age has moved over the 3 years from initially being 48 plus, whereas this year in our Certificate 3 aged care we're down into our 20s. Each year the age lowers as we train more people. We no longer have to have huge recruitment campaigns. People who have, the word of mouth is very active in the country. So we have people who are already interested before we advertise either the aged care or the Div 2 or the conversion. What this means for our healthcare services is a whole change in culture. We now have PCAs we've probably trained about 100 PCAs, and we've filled every aged care facility within 100 kilometres, I would say. Some people choose not to stay in the health workforce and go off to do other training in other areas, having stepped out of perhaps into a career and realise that they can train. We maintain about 2/3 either within our HAC aged care sector or within the acute sector. And what that has done, it means that people who have been working in the aged care facilities, in the past there wasn't staff to fill them when they went on leave. So people wouldn't go on leave, or they wouldn't retire because they knew there wasn't a workforce to come in to look after patients and clients. Now that has changed. The current clients have a better standard of care because you have people coming in with cutting edge information, learning new things, implementing that as they're learning and working. You also have the current clients who are seeking more training, more education, because they're being pushed by the people who are actually being trained currently in our program, from Cert 3 right through to Division 1. There have been enormous challenges in terms of it was new and industry based, and I think lots of people haven't realised that the workforce shortages are impacting. There's still an expectation we can advertise and get people. I think what you need is commitment from a board level down. Our board committed the funds initially in training, so your governance has to be involved. And then from the health service perspective, you need CEO commitment, Director of Nursing commitment. But it's really essential that you have 1 or 2, and especially 2 to 3. I don't think one person can drive it. We had 3 people who were energetic and also having the right links with the RTO. We had the right person in the RTO who fully supported us on that journey. And also we had a two directors of nursing who were very enthusiastic about a nurse workforce career pathway model. You still need that leadership. You still need people who will continually drive that forward. And I think some of the things that we have learned is that communication is really important at all levels. We've found that the support for the students on a personal level, far greater than what most people would expect when you put students into a classroom. We provided petrol vouchers, personal support, drop-in counselling situations, so that that journey of learning and education becomes supported and people know who to go to and where to go to for all levels of support. And I think that's really important as well. Students who have come through that pathway are now contributing back by being mentors. They're actually providing research around what it has meant for them in their life. Their families have got an example of a parent who has gone through education, now has a career. For lots of people, this is the first career they've had. So we have also provided the workforce with leaders. Some of those people who've come through, because of their level of training, they've come from small business. We've put a whole range of modules into their education. It's not just straight Div 2. So they come out, they have dementia training, they have aged care, they have lifestyle and leisure, they have planning, they have service coordination. So they have naturally become leaders themselves within the workforce and in supporting people.